Ever wondered about those tiny pebble-like deposits that can form in your gallbladder? Yes, we're talking about gallstones. These small but mighty intruders hold a curious place in the world of human physiology. They're essentially hardened deposits that develop in your gallbladder, a small organ located just beneath your liver. The story of gallstones begins with bile, a digestive fluid produced by the liver and stored in the gallbladder. Now, this bile is a concoction of cholesterol, bile salts, and bilirubin. When the balance among these components goes awry, gallstones can form. Too much cholesterol or bilirubin in the bile, or not enough bile salts, and voila, you're on the path to forming gallstones. These gallstones can range from the size of a grain of sand to that of a golf ball. Some people might develop just one gallstone, while others might develop many. So now that we understand what gallstones are and how they form, let's explore what happens when they start causing trouble. How do you know if you have gallstones? What are the telltale signs to look out for? Well, the most common symptom of gallstones is a severe pain in your upper abdomen, also known as biliary colic. This pain usually occurs in the middle or right side of your abdomen and can be quite sudden and fast in onset. It can last from 1 to 5 hours and can even spread to your back or shoulder blade. Another symptom to be aware of is jaundice, which is a yellowing of your skin and the whites of your eyes. This happens because a gallstone has blocked your bile duct, causing bilirubin, a yellowish substance, to build up in your blood. Other less common symptoms can include nausea, vomiting, and a high temperature. These symptoms occur due to the inflammation caused by the gallstones obstructing the bile ducts. Recognizing these symptoms is the first step towards diagnosis, but what happens next? So, you have symptoms that suggest gallstones. How can they be confirmed? Let's delve into the diagnostic process. First up, blood tests. These can't directly detect gallstones, but they can hint at complications like a blocked bile duct or infection. Rising levels of bilirubin or liver enzymes could be a sign. Next, we have imaging studies. An ultrasound is often the first port of call. It uses sound waves to create images of the gallbladder and can usually spot gallstones quite effectively. For a more detailed look, doctors might opt for a CT scan. This can reveal gallstones and help identify inflammation or other complications. Finally, there's the HIDA scan, or hepatobiliary immunodiacetic acid scan if we're being formal. It tracks the production and flow of bile from your liver to your small intestine and can show if gallstones are obstructing the bile ducts. Once gallstones are diagnosed, what are the treatment options available? Diagnosed with gallstones? Don't worry, there are several effective treatment options. Let's delve into the various strategies that medical professionals employ to treat gallstones, ranging from a hands-off approach to medication and even surgery. First, let's consider watchful waiting. This approach is typically chosen when gallstones aren't causing any symptoms. Since these stones sometimes don't lead to any complications, doctors often opt for a wait-and-see approach. If symptoms do develop, however, treatment may be necessary. Medication is another widely used treatment option. Certain drugs made from bile acid are designed to dissolve gallstones. These medications can be effective, but they often need to be taken for a long time, up to several years in some cases. It's important to note that this treatment isn't suitable for everyone. It's generally reserved for those who cannot undergo surgery and have small cholesterol-based stones. Keep in mind, though, that gallstones can recur once the medication is stopped. Now let's talk about the most common and definitive treatment for gallstones: surgery. A procedure known as a cholecystectomy or gallbladder removal is often performed. This procedure is highly effective, and with the gallbladder being a non-essential organ, life can continue pretty much as normal without it. However, like all surgeries, it's not without its risks, such as infection, bleeding, and adverse reactions to anesthesia. Another surgical approach is the endoscopic retrograde cholangiopancreatography, or ERCP. This procedure is used when a gallstone is lodged in a bile duct. The stone is captured in a tiny basket and removed, relieving the patient of their troublesome symptoms. Each treatment option carries its own set of benefits and potential drawbacks. The right choice depends heavily on the individual patient's condition, overall health, and personal preferences. It's crucial to have a comprehensive discussion with your healthcare provider to understand all the risks and benefits before deciding on a course of action. But what if gallstones are misdiagnosed or mistreated? Stay tuned as we delve deeper into this topic in the next segment of our journey through the world of gallstones. And not all abdominal pain is due to gallstones. What happens when gallstones are misdiagnosed? Misdiagnosis can lead to a slew of issues. Unnecessary surgeries might be performed, causing undue stress and risk to the patient. Sometimes this can even lead to complications such as infection, bleeding, or injury to nearby organs. But there's more. Misdiagnosis means that the actual underlying condition goes untreated. This could range from gastritis to appendicitis, or even more serious conditions like stomach cancer. Each of these requires a different treatment approach, and delay can be dangerous. Furthermore, mistreatment can increase the risk of complications. For instance, inappropriate use of medication can exacerbate the condition or cause harmful side effects. In such situations, it's crucial to seek a second opinion. Remember, it's your health, and you have every right to be sure about your diagnosis and treatment plan. Gallstones can be a pain, but with the right knowledge and treatment, they can be effectively managed.